I can tell you 5 deadly habits that people unconsciously adapting and believe them as normal or beneficial for them, but they are biggest cause behind sudden deaths nowadays. I've worked as the emergency nurse for over 45 years. I am 85 now. Let me tell you a case of a 58 years old marathon runner. She seems healthy by every aspect, having no risk factor. But she died suddenly at an afternoon while working out in 1995. Apparently, it was a sudden cardiac arrest. When I personally investigated it by talking to his husband and friends, I found out some clues. These were actually some habits that a significant number of population have, and it's increasing today. So I conclude these 5 habits for you. The first habit is pushing your body beyond its limits and never knowing when to stop. She was the perfect example of this. The marathon runner was not lazy. She was not careless. She was one of the most disciplined people I ever came across. In the final 2 years of her life, she doubled her training mileage, woke up at 4 in the morning to exercise, and kept pushing harder every single week. Everyone around her saw dedication. What nobody saw was that her body had been begging her to slow down for months. She was exhausted after runs that used to feel easy. Her heart rate was higher than it should have been at rest. Her sleep had stopped restoring her. But she ignored every single sign because in her mind, pain meant progress. It did not mean progress. It meant her heart was running out of room. When you push your body past its ability to recover, your stress hormone cortisol stays elevated for too long. Inflammation builds up inside your cardiovascular system. A study in the European Heart Journal found that athletes who consistently train beyond their recovery limit developed actual scarring on their heart muscle. That scarring interferes with the heart's electrical signals, and that is what causes sudden cardiac arrest. Stay active. Exercise every day if you can. But when your body tells you it needs rest, believe it. Because by the time it stops asking and simply stops working, there is nothing anyone can do. The second habit is being health conscious without any medical guidance and trusting the internet more than a doctor. They read every health article. They bought every supplement on the shelf. They followed extreme diets, took handfuls of vitamins daily, and pushed themselves through intense gym routines, all on their own, with no professional advice, because they believed they were doing the right thing. Some of them did serious damage to their own bodies without ever realizing it. I saw patients come in with kidney damage from taking too much protein for too many years. I saw men in their 50s with dangerously high calcium levels because they had been taking large doses of vitamin D on their own. I saw women with bones so weak they looked decades older than they were, from years of extreme diets that stripped their bodies of essential nutrients. A 2020 study in the British Medical Journal found that taking high-dose calcium supplements without a doctor's guidance raised the risk of high blood pressure and a cardiovascular event by up to 20%. Before you take any supplement, get tested. Before you start any extreme diet or heavy training program, talk to a doctor. Good intentions without the right knowledge can cause just as much harm as not trying at all. The third habit does not look like a medical condition. It arrives with no diagnosis, no scan, no prescription. It looks like a lifestyle choice, a preference, a personality. But after 45 years of watching what it does to the human body, I am telling you that social isolation is as physically dangerous as almost anything else on this list. The patients who stopped going out, who lost touch with friends after retirement or after a spouse died, who had no one calling, no one visiting, no one sitting across from them at dinner. Those patients declined faster than almost anyone else I cared for, not just emotionally, physically. The biology is now well established. Chronic loneliness activates the hypothalamic pituitary adrenal axis, your body's central stress system, causing continuous cortisol release. Over time, this sustained cortisol elevation suppresses immune function, raises blood pressure, degrades sleep quality, and directly accelerates neurological aging. A 2015 meta-analysis published in Perspectives on Psychological Science, analyzing data from over 3.4 million people, found that social isolation increases the risk of early death by 29%, statistically comparable to smoking 15 cigarettes every single day, 15 cigarettes a day, from being alone. Grief is real. I have sat inside it with enough people to know that. But isolation is not grief. Grief moves even when slowly. Isolation stops. And the body cannot sustain that stillness indefinitely. One phone call, one neighbor, one reason to leave the house. It costs nothing. And it is more powerful than most medication I ever administered. The fourth habit is the one that made me want to sit with every patient and explain it slowly until I was absolutely certain they understood. Stopping prescribed medication because you feel better. A patient would come in, heart condition, high blood pressure, diabetes, and we would stabilize them, send them home with a prescription and clear instructions. Weeks later, they would be back, sicker than before, harder to treat. And when I asked what happened, the answer was almost always the same. I felt fine. I thought I didn't need it anymore. Feeling fine was the medication working. The condition had not disappeared. It had been managed. The moment management stopped, the condition returned, faster and harder than before. The pharmacology here is precise. With statins, discontinuation causes LDL cholesterol to rebound within 2 to 4 weeks, often 20 to 30% above pretreatment baseline, immediately resuming plaque accumulation in arterial walls. With anticoagulants like warfarin, stopping abruptly creates a rebound hypercoagulable state, dramatically increasing clot risk within 48 hours. A landmark study in the Annals of Internal Medicine found that medication non-adherence accounts for approximately 125,000 deaths and up to 25% of hospitalizations in the United States every single year. 125,000 deaths from simply stopping a prescription. If you want to stop, reduce, or change your medication, have that conversation with your doctor. But do not make that decision alone, at home, on a morning when you happen to feel well. Feeling well is not a reason to stop. It is proof that the medication is doing exactly what it was meant to do. The fifth habit is the one our entire culture has spent generations teaching people to be proud of ignoring. Chronic poor sleep. I'll sleep when I'm dead, people used to say. And I would think quietly, at this rate, you are accelerating that considerably. Sleep is when your body performs work it cannot do while you are awake. During deep slow-wave sleep, the brain's glymphatic system activates, a fluid-based waste clearance network that flushes amyloid beta and tau proteins from brain tissue. These are the precise proteins that accumulate into the plaques and tangles of Alzheimer's disease. A 2019 study in Science found that even a single night of sleep deprivation caused a 25% increase in amyloid beta accumulation in the human brain. One night, 25%. Beyond the brain, sleep is when cortisol drops and human growth hormone surges, driving cellular repair throughout the body. It is when blood pressure falls to its lowest point, giving your cardiovascular system its only daily rest. The American Academy of Sleep Medicine has linked chronic sleep deprivation, under 6 hours per night, to a 48% increased risk of heart disease, a 36% increased risk of colorectal cancer, and a significantly shortened overall lifespan. 7 to 8 hours, a consistent schedule, a cool, dark, quiet room. This is not optional comfort. This is biological maintenance your body has required every night of your life. She was 58 years old. She ran marathons. She did everything that looked like health. And she still died alone in her kitchen on a Wednesday afternoon. Fatigue she explained away for nearly a year. Blood pressure she never checked. An isolation she hadn't noticed settling in. A medication she stopped because she felt fine. Sleep she had been cutting short for years because there was always more to do. Every warning was there. Every door was open. I am not here to frighten you. Frightened people do not change. Informed people do. Pay attention to how you feel when you wake up. Check your blood pressure. Stay close to the people who matter to you. Take what your doctor prescribed. And sleep. Actually sleep. These are not complicated things, but they are the things that over 45 years I watched people skip. Please don't make me watch it happen to you.